Okay, greetings to everyone who has joined us on this webinar today. So thank you again for joining us for our conclusion to the International Women's Day campaign that we've been having. So again, my name is Aditya. I work with the Accelerate program, which is supported by USAID and PEPFAR and implemented by the Johns Hopkins University School of Medicine. So this International Women's Day, we've actually been fairly active since the end of February. We've been running a social media campaign. We've been engaging with our staff. Also to get out messages that essentially align with the theme for this year's International Women's Day. And the theme is again, gender equality for a sustainable tomorrow. But as a sub campaign, there's also the break the bias. And that basically is what excited us because as a lot of you know, the Accelerate program works with diverse populations and basically around the areas of innovations in HIV. We also work with the transgender population and have a lot of staff members that also identify themselves as women. And I think we did want to pick up on that because a lot of our staff also felt that on International Women's Day, they would also like to assert themselves in line with what is happening. So I think having said too much about that, I think I would like to play to you a quick video summarizing some of our campaign. You'll also get to have a quick look at some of our staff across India. So please enjoy this 2-minute video.
The gender stereotyping has pushed the transgender people and people living in other genders into the darkness and oblivion. This has not only created the insensitivity but also transphobia in the society towards transgender people. So on this Women's Day, let us break the bias of gender bias.
As a transgender woman, I'm working for the betterment of trans community and contributing to society. I'm breaking the bias.
I am a trans woman. I work in Mitra Clinic. I want to marry. Break the bias.
What I want to share today is being HIV positive is not end of your life, which is the biggest myth which I believe. If you are taking your medicines regularly and on time every day, you can have a healthy long life. So it's very important that you take care of yourself and you accept the way you are. And this is my request to everyone who's not from the community and who's not HIV positive to extend their support to people who are from the pure HIV community, because we need to build a society, a community which is harmonious and where we all live together and we have compassion towards each other. And this is how I am breaking the bias. So break the bias.
Let's use sanitary pads, break the bias.
I hope you enjoyed that video. So I think without further delay, I'd just like to move on to the speakers and give maybe just a little bit of context. So what I wanted to share was, why are organizations like us or programs like us talking about women, talking about SRH HIV integration. Well, we're all committed to achieving the UNAIDS global goals for 95, 95, 95. Most of us here today are experienced in working with HIV. But there's also a kind of expansion of what those 95 goals are. So it's SRH is another important aspect that is talked about in the UNAIDS goals. It's something that we are also been exploring recently with the Positive Women's Network. We've been trying to develop programs, strategies where we can actually align with SRH needs. And this is again not just about family planning and pregnancy, etc. It's also about the SRHR, the sexual health, as well as services not just for women, but also for those for others, such as transgender populations who would benefit from the expansion of HIV services or other comprehensive service delivery in the context of HIV. And that's really what we wanted to talk about today. So one was that, pushing that into maybe the thinking of, say, HIV programming. And the other was maybe looking at, breaking the bias in terms of how we maybe view the gender binaries, and how maybe that it's important to understand that, women go beyond those binaries, and how we can actually customize programs for that. So without further delay, I think I'd like to share with you that we have extremely esteemed panel of speakers today. We have speakers from the Johns Hopkins University, from USAID. We have Dr. Shobhini from NACO. Again, such a pleasure for us to have Dr. Shobhini again with us. We have Kaushalya from the Positive Women's Network. And again, we have quite a few people joining us. Again, the question answers for each of the speakers can be directed in the chat box for those who are joining us as participants. So just share your questions. We'll be having an interaction and moderation by our colleague Ashmita towards the end. We'll try to pick up those if we are good on time. All right. So our first speaker today is Dr. Sunil Solomon. Dr. Sunil Solomon works with the Johns Hopkins University. He's an associate professor in the Department of Infectious Diseases. He's also the chief of party for the Accelerate program. Presently, he's in the US, but he also spends a lot of time in India. So without further delay, I invite Dr. Sunil Solomon for his remarks, please.
Thank you, Aditya. Are you able to hear me?
Yes.
Great. So good afternoon or good morning, depending on where you are. I want to start by just thanking you, Aditya, and the team Accelerate for putting together this event and for the opportunity to speak here today. I think the one thing we all need to remember is, despite all the progress that we've really made with the HIV epidemic or pandemic over the past 40 years, we really need to remember that AIDS-related illnesses are still the leading cause of death among women aged 15 to 49 globally. These are women in like their most productive years, and AIDS still remains the leading cause of death. And I think what is even more striking is that almost 2/3 of new infections in 10 to 19-year-old occurring globally are among women. So I think despite all these prevention and treatment tools that we have at our disposal, and like all these new interventions that we have identified over the past decade, HIV still continues to devastate women and girls in their most productive years of their life. I think the reason for these are really multifactorial. It partially reflects our still predominantly patriarchal societies. There has been a lot of change, but there still is an ongoing impact of gender inequities, gender-based violence. And I think in India, we should all remember that in the early years of the pandemic, when infections were being recognized among married monogamous housewives, most often these infections, or almost 95% of these infections, were brought to their households by their partners or their husbands. But in most contexts, we ended up blaming these women, saying that these women were the ones who brought the infection into the house. So we really do have to evolve quite a bit, and we've come a really long way with expanding our arsenal and trying to come up with more female-centered prevention or female-controlled prevention strategies. But we still struggle with the deliveries. Like, we often deliver these services without taking into context the socio-cultural environments that women globally live in. It's not just an Indian thing, but I think globally we fail to consider the socio-cultural context in which women reside, and these programs generally are tailored more towards men than to women. I think to really make a difference, we need to start taking a more female-centric approach and trying to design these programs to ensure that we build into these programs interventions that do address and the context that women currently live in. So even if you take the most effective prevention strategies we have, besides the treatment is prevention, I think PrEP is one of the biggest tools that we have identified over the past decade. Unfortunately, globally, it is still men, and it's not an Indian thing or a sub-Saharan African thing. Even in the US, there is a a rampaging or ravaging HIV epidemic in the down south, especially among Black women in states like Mississippi and Louisiana. But you still see, even in the US, that the largest proportion of people accessing PrEP are men. Right? So we really do have a long way to go. And to move forward and to achieve these 2030 targets, we really need to stop talking about doing these gender specific models and actually start making them happen. So I think we have been having this conversation for almost a decade or 2 decades now about how do we make these services more women centric or girl centric. But I think it's high time we actually start making this happen. And this is something we are trying to do via Accelerate. And the other thing is these programs cannot focus, like as Aditya said, purely on HIV, but it needs to incorporate women as a whole and take a more holistic approach to health, incorporating reproductive health, social services, education, and livelihood services. I think there have been a lot of evidence that has shown that keeping girls in school reduces their risk of HIV infection. Providing economic opportunities to female sex workers reduces their risk of HIV infection. So we really need to be taking this holistic approach to women to identify the context and really tailor programs to address this multifaceted intervention strategies that are required to impact this population. And I want to end just by reminding people, or actually I am more reminded today of what my mother really taught me, was that we really will not end this pandemic without investing in women and girls. Thank you again for the opportunity, and I look forward to participating in the panel. Thank you.
Thank you. Thank you so much, Dr. Sunil, for those insights. Our next speaker is Dr. Sangeeta Kaul. Of course, a lot of our attendees here would know Dr. Sangeeta Kaul. She is the chief of the HIV/AIDS division in USAID India. She is also a great support to the Accelerate program and is a guidance balancing factor between what it is that we do on the ground in between USAID and the directives from PEPFAR as well. So speaking today, Dr. Sangeeta Kaul will be talking about in the context of USAID and PEPFAR programs. Dr. Sangeeta, warm welcome to you. Thank you for joining us. Over to you.
Thank you, Aditya. A very good evening and good morning. I bring warm greetings from USAID PEPFAR team. We all are aware that gender inequality is a significant barrier to the achievement of sustained HIV epidemic control. Gender inequality results in unequal access and use of HIV prevention, care, and treatment services. It impacts individuals' ability to initiate and practice healthy behaviors, exercise their right to live free from violence, stigma, and discrimination, and achieve the highest attainable standard of health. There is definitely a strong link between gender inequality and gender-based violence, especially in the context of HIV/AIDS. Gender-based violence is a significant human rights violation that is deeply rooted and driven by gender inequality. A systematic review and meta-analysis concluded that the exposure to gender-based violence, especially intimate partner violence, is associated with a lower use of antiretroviral therapy and significantly worsened viral suppression among women. In addition, intimate partner violence negatively affects the uptake of early infant testing and HIV status disclosure among postpartum women, thus threatening the progress to PMTCT. Studies have also shown that women who reported recent intimate partner violence were at increased risk of lower PrEP adherence. In fact, gender inequality also impacts boys' and men's access to services. Especially in the African countries, boys and men are less likely than girls and women to know their HIV status, initiate or remain on lifelong treatment or attain viral suppression. Even the members, even the members of key populations and LGBTQI plus individuals experience high levels of gender-related stigma, discrimination, and violence. In alignment with the UNAIDS 10-10-10 targets and the second 10 target of less than 10% of women, girls, people living with HIV/AIDS, and key populations experiencing gender inequality and violence by 2025, PEPFAR plans to integrate gender transformative approaches in the HIV/AIDS program implementation and service delivery. These efforts are essential to respond to the structural barriers fueled by gender inequality that impede access to an uptake of critical prevention and treatment services that are key to reaching sustained HIV epidemic control. Talking about gender transformative approaches, this refers to policies and programs that seek to transform gender relations to promote equality and achieve the program objectives. For HIV prevention services, the focus is on evidence-based interventions that engage and support men in recognizing and challenging the gender norms and improving HIV outcomes. For HIV clinical cascade services, focus is on addressing the structural barriers to finding, reaching, engaging, and retaining men in the clinical cascade. Emphasis is also on integrating age-appropriate gender-based violence care identification into the HIV services. Now, coming to the personnel and systems level, the focus is on working with civil society, partner country governments to promote laws and policies that advance gender equality and prevent gender based violence. In fact, we are fortunate to be living in India where the laws and policies have been amended to be KP and transgender friendly. It is essential to create a broad institutional framework in which HIV programs and services are delivered with equity and equality. We also need to support the development and maintenance of robust gender sensitive data systems to improve planning, delivery, and monitoring of HIV services. Now, all these aspirational approaches can be achieved by partnering with diverse stakeholders, including local change agents, the private sector, community members, faith leaders, health providers, education and social justice official representatives. Last but not the least, safeguarding against violence within the PEPFAR programming against children starts with ensuring that children are safe while accessing services. We strongly emphasize that the PEPFAR implementing partners are responsible for establishing, implementing, and monitoring child safeguarding procedures to protect children from harm. Thank you so much. Over to you, Aditya.
Thank you so much, Dr. Sangeeta. I think it's wonderful to know that PEPFAR is also looking at gender transformative programming, and I hope that we can maybe get something on the ground, like Dr. Sunil also mentioned. Our speaker up next is Dr. Shobhini Rajan. So Dr. Shobhini is a DDG with NACO. She presently heads various programs, but most importantly is also working with the TI division in NACO. She's worked on several areas within NACO, including STI, blood safety, lab services, possibly everything that NACO does. I think Dr. Shobhini has led at some point of time. So I know it's a very busy schedule for you, Dr. Shobhini. Thank you so much for joining us today. Dr. Shobhini will be talking a little bit about NACO's programs, which are designed specifically for women, and maybe what the plans are in the future, given that NACP 5 has also just been announced. Okay, Dr. Shobhini, over to you. Thank you so much again.
Thanks, Aditya, for that lovely introduction. And my greetings to Sunil, Dr. Sangeeta, and Kaushalya, and my dear friend Simran, and all the people who are gathered here to listen to this webinar. So the theme of the International Women's Day is gender equality today for a sustainable tomorrow. And this UN theme also kind of links up to the end inequalities theme of the global AIDS strategy. And when we look at the vulnerability of women and girls and adolescents to HIV, we do understand that they are, given the patriarchal setup of many parts of India, more vulnerable. So in terms of working for women, uh, the EMTCT program under the National AIDS Control Program is primarily to look into ensuring access to HIV testing for more than 3 million pregnant women. 30 million, 3 crore pregnant women, and make sure that the babies that are born to these 20,000 or 21,000 odd HIV positive women uh, helps them to stay HIV free. So although that this does not look into the gender connotations per se, but it is certainly an intervention specifically for women. The other area is that under the targeted interventions, services are provided for female sex workers. The population would be close to probably 8 or 10 lakhs of them across the country. And in terms of, although the HIV program deals with only HIV prevention and control, we all know that HIV prevention and control cannot be looked at from only a health perspective. So the social connotations and the empowerment of communities per se does take place when you provide them with these services in a community-centric approach. Now, NACO with Global Fund support and along with all the PEPFAR partners is working on the community system strengthening area, where again we are looking into strengthening the systems as well as strengthening individual capacities across communities, and female sex workers form a major part of this community along with female injecting drug users. And last but not the least, I would not talk about transgender women who are for NACO, the women that we work with across the TEIs in order to provide them HIV prevention and control, but they are also the population that we are trying to provide integrated services to. And I would congratulate Project Accelerate and Dr. Sangeeta to having set up these transgender specific clinics across different project sites. And I'm also happy to inform you that the National AIDS Control Program has partnered with All India Institute of Medical Sciences, New Delhi, to begin perhaps the first transgender health clinic in a tertiary government facility of the likes of AIMS. So, of course, this is not something that we have launched or what do you say, cut a ribbon for, but it is certainly that a sort of enabling environment has been created in a tertiary institute of repute, and we look forward that this approach will be then picked up by other institutes. We also, wanted to look at the women living with HIV/AIDS in terms of providing them with sexual reproductive health services along with family planning services. And here I'd like to make special mention of dealing with cancer cervix screening for these populations. And that is something which is very likely to see light of the day in the NACP 5 that we are looking forward to. Under the program, we are always used to having a very equal gender normative and a gender, not a gender normative, but a sort of inclusive environment wherein we also appreciate diversity and we never sit on judgment over anyone with respect to their gender expression. So having said that, there is a lot of area to cover, and the NACP 5 opportunity gives us about 5 more years to look at how we can do work for women as well as genders well. So that's it from me. Over back to you, Aditya.
Thank you so much, Dr. Shovni. I think everyone here is equally excited about NSCP 5 and maybe the fresh perspectives and activities that it's going to bring. Our next speaker is Miss Kausalya. She's, of course, a very well-known face in India for HIV activism in its early days. She's also one of the strongest advocates for women living with HIV. In fact, she single-handedly has established one of the largest networks of for women living with HIV now, which has chapters all over India. And at this point of time, is also exploring specific programs around SRHR for women living with HIV. So the other thing about Kaushalya is that Kaushalya also won the Government of India's Nari Shakti Puraskar in 2015. Again, this was to recognize her activism and all the work that she's done in terms of service delivery to women living with HIV. So we actually have a recorded message from Kausalya, but we also have Kausalya joining us live, so she will be able to respond to questions. So if you can please play Kausalya's video.
Namaskar. My name is women living with HIV group. Namaskar. My name is Kausalya. I am from Positive Women Network. Positive Women Network is actually for women living with HIV group. It started in 1998. We are working for women living with HIV together to fight for our own rights and also our children's rights. More issues are there. Though we are achieved so much, but we are actually not able to achieve so many things. That one of the thing is actually for we have the government has given ART drugs free of cost, and then also the pregnancy and the delivery is happening and zero prevalence among the children. But we are not able to achieve many things is actually for women living with HIV focused program is not available. That one of the things is actually for ART is available, but the thing is like other ART related so many issues and knowledge on women living with HIV, what infections they will get it, how they will take care of themselves, and then other care of the gynecologist issues, and then reproductive health problems, infections among the women related ART related women problems. This is an all unmet need is there for women living with HIV. Though government is providing for preventions among the women in sex work, and also some care is available for women in sex work and also IDUs, women in IDUs to preventing in the infection to other people. But the care for women living with HIV is actually very, very lacking. And among the adolescent young girls are getting information is very much lacking. That we needed for more information, education on ART and the ART related side effect and how to take care of our health and how to take care of our reproductive health. And we have to reach many more women not get HIV infections, preventing the fourth prong of pregnancy, fourth prong of PPTCT program and maternal health program of HIV should reach that four prong. That four prong, in one of the prong is preventing among the young girls on HIV knowledge, so that we are not reached in so far in our country. And then to keep live on ourselves, getting ART medication, getting knowledge after infections to the family members, and then to deliver and then taking care of children to be zero, that is available. Last prone, our partner to live, and then our child to be alive, they should also get a knowledge, they should also get their own reproductive education, sex education, and then their own partner choosing, how to choose their partner, and then how to live their life in the healthy manner. So this is important of one of the four prone of last one is not met with at all. So we have to think and act on it in the future for women living with HIV and young girls. Life is very important. We have to design the program in the HIV program accordingly. And the same thing in we are affected. So many women are in outside. They are not affected. They should get a HIV information also. Thank you so much. Thank you for Accelerate for giving this chance to me.
Thank you, Kausalya ji. I think those are very relevant issues, and like you mentioned, I think it's across ages, across geographies, and across maybe risk factors and vulnerabilities that we need to customize these programs, which is why we wanted to have this discussion in the first place. Our last speaker for today is Simran Bharocha. So Simran works with the Johns Hopkins University Accelerate program as the director for transgender health. She is presently on field visits, but she has sent us a recorded message as well. I think Simran is joining us live, so she'll probably be able to take questions as well. We can have Simran.
Hello, thank you so much. My name is Simran, and I'm the Director for Transgender Health at Accelerate for Johns Hopkins University School of Medicines. Today, on the International Women's Day, I would love to congratulate all the beautiful women. A beautiful, heartwarming, celebrating International Women's Day. I am a proud woman. Although I was not born with the female genetical organs, I am yet a proud trans woman. Although I was not given a wings to fly during my education days, I overcome the struggles, the barriers of breaking the gender binaries and being a woman. I was never ever given an equal opportunity to be sitting across a table, either in a corporate or a social sector. But today, I have turned the tables round where corporates and beautiful organizations would want transgender people. People like me are not minuscule. People like me are not minuscule. We are a greater force of womanhood. I was not being able to receive my health rights while I desperately needed them. Today, we have turned the tables round where our community, our medical officers, nurses, surgeons, psychiatrists, psychologists, and they serve the community. One of the concepts that today is changing the world's mindset is not equality. It's focusing on equity. Today, everyone knows that equality cannot stand alone. There needs to be an equity with equality to make it a true sense of equal and inclusive society. With the great initiatives of USAID and PEPFAR along with the Government of India, we have managed to create such great examples where community are serving the community. Gone are the days when we were relying on people to actually have a word with us. Today, our community is serving us. And that what makes the table change. We are no more a minuscule. Believe me, we are no more a minuscule. We are equally representative and contributing to the country's GDP along with empowering our own self. On this International Women's Day, I urge and I pledge to break the biases within the society that you cannot be shaming or you can't be naming gender stereotypes. Yes, we are beautiful women. Yes, we are beautiful human beings. So let's join our hands together and celebrate this year's International Women's Day by breaking the bias. Thank you so much. Namaskar.
Thank you so much, Simran. So I think we have completed our speakers' respective talks for today. We have a few questions, and Ashmita will be moderating the question answer rounds. So do you want to go ahead, Ashmita?
Yeah.
And let me just also introduce Ashmita. So Ashmita is a member of the Accelerate team for under a year, and she's actually been spearheading our International Women's Day and other campaigns on social media. And she works as a documentation and communications focal point in our team. Okay, over to you.
Yeah. Hi, everyone, and thank you all the panelists for a wonderful talk. We have two questions right now. One is, any approaches for women's vulnerability in refugee or migrant population? This is Dr. Shobhani. Would you like to answer this?
And Dr. Shobhani, this question is from Dr. Neeraj Linga.
Yeah, Dr. Shobhani, can you hear us? Or if not, Dr. Sangeeta Kaur, would you like to answer this question?
Thank you, Ashmita, and thank you, Dr. Neeraj, for this question. This is very valid, seeing that we have a large number of females who are a migrant and they come from other states. Definitely in the geographies, I'm speaking from PEPFAR perspective, the geographies where USAID is working mainly in Maharashtra, Thane and Pune, as well as in Telangana, 5 districts. We would be applying this gender integrated programming for the HIV prevention services for this cohort of population as well. Thank you.
Thank you, Dr. Shobhani. So the other question that we have is, will Accelerate also work towards judicial laws around HIV? So Aditya, would you like to take that question?
Sorry, could you repeat the question again?
Yeah. Will Accelerate also work towards judicial laws around HIV?
So, laws around HIV. So, we are here to support NACO in the implementation of the HIV/AIDS Act. When it comes to laws around HIV, of course, every law in a way is linked with HIV. So, I think what we try to do is maybe develop environments that are enabling for people to access services, to translate availability into accessibility, whether it's working in the law context or in the context of policy or implementation. So I would say yes, but not directly say in terms of advocating for a change or modification or amendments in terms of what is in the constitution or in existing laws, but maybe in terms of making health programs more accessible to them.
Yeah. Okay. Thank you, Aditya. So we have one more question, and it's so Simran is not here right now. Rachna will be answering on behalf of her. So the question is, how do you fit transgender in the Women's Day context? Yeah. Can you answer, Rachna?
Ashmita, while you're waiting for the response to this question, I just wanted to add regarding the work of judicial laws around HIV. USAID has different sets of partners for different interventions, while Accelerate program is more focused on evidence-based interventions and piloting innovative approaches. We have UNAIDS as our partner for policy and advocacy, and they are mandated to work around the laws of around HIV/AIDS. Just wanted to highlight that. Thank you.
Shall I go? Hello?
Yes, please, Rachna, go ahead.
Thank you, thank you. As we all know that we have...
Rachna? Oh, Rachna is here. Hi, Rachna.
Hi.
Yes. So the question that we have for you is, how do you fit transgender in the Women's Day context?
How do you? Sorry, repeat it.
Yeah.
Come again.
How do we fit transgender in the Women's Day context?
I feel like it's a transgender women day too, because as I said in my previous video also, that the world is in binary, and we are breaking the bias of binary, and we are also asking to accommodate the diversity within the gender spectrum, and making inclusive of all the policies for welfare and also sexual violence against women to be made available to the people with other genders, including transgender people. So I feel that this Women Day is also inclusive of transgender women, whatever the vernacular identity they carry on, whether Hijra, Kinnar, Aravani, Tirunangai, Nopi Manbi, Shiva Shakti, or any such sort of vernacular term used to identify for trans women in India mostly. Yeah.
Thank you, Rachna, for your answer. So I think the time is up.
One for Kausalya.
Yeah, okay. So Kausalya, the question that we had for you was, the theme this year is gender equality today for a sustainable tomorrow. How do we achieve this in India through women networks? Can you please answer this?
You mean through women networks you are saying?
This is for Kausalya, Rachna.
How we achieve the gender equality through the women networks that's the question?
Yeah, that's the question. This is addressed to Kausalya.
This is addressed to Kausalya. Okay.
Okay. Actually, for in the sustainability, we are already actually doing ourselves our own issues. We are bringing it in the notice of government. So we never stop it without any delay. But we need resources. Without resources, we cannot able to achieve our vision and mission also. So we need resources, but we don't want to stop the resources for money only. We need resources for everything, because this particular program, what we are doing along with UNESCO, we are actually, UNESCO is giving little money, but we are actually raising resources with Accelerate for some of the technical support. We are actually taking in the support in the translator as a volunteer, and also many other people are supporting in this particular program to achieve our goal of sexual reproductive health. But the thing is, we need that support coming in the timely. So that is very, very important. It is not like later it's coming in, so it never helps us. So we need a resources. Without resources, we cannot able to do anything in the achieving in the sustainable goal. So very important for any women group. The women living with child group or transgender community group or sex worker women group need a resources to sustain their activities, and also need a handful of resources. Means like the community always to have some resources available their hand, so they can take that interest and do whatever they wanted, whatever the issues that we are facing it. So that is my view. Thank
you so
you.
much for your answer. I hope all the questions that the audience asked were answered, and thank you so much for your participation. So I think we have come to an end to this webinar, and I would like to extend on behalf of Accelerate thank you to USA, PEPFAR, and the generosity of the American people. And I would also like to thank NACO, JHU School of Medicine, Biology Care, and other implementation partners. And most importantly, I would like to thank women across the globe in the past and in the present who have made us and who have helped us basically break the bias and become a bolder and a better version of ourselves. Thank you, everyone.
Thank you.
Oh, anything you want to say?